Madam President, I come to the floor today as a physician who's practiced medicine in Casper, Wyoming for about a quarter of a century because of concerns I have about the President's health care law, part of which has taken over $500 billion from our seniors on Medicare and taken that money not to help Medicare, not to save Medicare, not to strengthen Medicare, but to put a whole new government program in place for people on a program called Medicaid, and they want to put about 16 million or so more people onto Medicaid. It's a program that is not functioning well now, where many doctors don't want to take care of patients on Medicaid, and yet as part of this health care law, there is something called the Medicaid maintenance of effort. I think 33 governors have written to the President and said, we don't want this to apply to us. Well, I'm delighted to be a co-sponsor of a piece of legislation called the State Flexibility Act. And I do that come to the floor with that as a physician who's practiced medicine and have been coming to the floor week after week with a doctor's second opinion. So today my second opinion is that this State Flexibility Act is a good idea. It gives states the flexibility that they need. It gives governors the flexibility that they have requested. And it is a bipartisan effort in the sense that governors, whether they be Republican or Democrat, are looking for more flexibility with this Medicaid program, and specifically the Medicaid maintenance of effort. So I'd like to ask my colleague, the senior senator from Utah, Senator Hatch, if he could perhaps tell us a little bit about this effort that you have now introduced, that I've co-sponsored, the State Flexibility Act.
Well, thank you, Senator Barrasso. I appreciate your perspectives on this important issue because you are a physician. You have cared for Medicaid patients, and you understand the Medicaid program better than anyone in this body. And now, Senator Barrasso, you've also served in the state legislature, so you have a state legislative experience, and you understand that unlike Washington, states must balance their budget every year. Unlike Washington, D.C., I guess I better say. I want to talk about our initiative to roll back the maintenance of the Medicaid maintenance of effort, or MOE, requirements that are threatening both Medicaid beneficiaries and the financial health of many states across the country. If you bear with me, I think that it is important to go through a little of the history on this subject. When Medicaid was first established as a limited state-federal partnership, less than 5 million Americans used this program. Today, nearly 1 in 4 are enrolled in this government program. Medicaid spending now absorbs nearly a quarter of all state government budgets, often forcing severe cuts to other critical state programs. Unfortunately, this situation is getting even worse with the Medicaid mandates first imposed in the stimulus bill and then again in the partisan health law. As a result of these Washington mandates, states are being forced to make drastic cuts to important priorities like education and law enforcement. States, unlike Washington, which too often just prints money to pay for out-of-control spending, actually have to make tough budget decisions every year. And the states are facing the worst budget crisis since the Great Depression, with a collective $175 billion shortfall. Washington's micromanagement of state Medicaid programs makes it incredibly difficult for the states to balance their budgets and provide for those who are most in need. Now, because of the overly generous benefit programs that Washington forces on the states, they are unable to target health services to those most in need of assistance. Governors are unable to undertake common sense reforms that root out program waste, fraud, and abuse. The result of these MOE requirements is nothing short of Washington-induced state fiscal crises.
Well, you know, I just asked my colleague that, because we're neighboring states, Wyoming and Utah, but I would ask if you could perhaps explain exactly how these Medicaid maintenance of effort mandates, these, I believe they're onerous Washington mandates, how they directly impact the state of Utah.
Well, my home state of Utah, where the projected fiscal year 2012 budget shortfall is approximately $390 million. That's a lot of money to us. My state has said, quote, the MOE requirements imposed by the federal government will cost the state $3.2 million annually. unquote. Now this might not sound like a lot to the people here in Washington, D.C., who don't bat an eye at trillion-dollar deficits. But in Utah, $3.2 million is a lot of money in the state budget. My close friend, Utah Governor Gary Herbert, has said, quote, "Not a state in this nation is immune to tough budget decisions, and sometimes Washington makes it even harder. Utah must seriously weigh the real cost of Medicaid, one of the largest and most expensive programs we have. Unfortunately, federal mandates tie our hands. Utah has zero flexibility to respond to economic conditions or the option to scale the program back in a way that reflects local values and priorities," unquote. Now, Governor Herbert and many other governors across the nation have repeatedly asked Washington to repeal these onerous Medicaid mandates. We have just introduced legislation, the State Flexibility Act, that you've mentioned so kindly, to do exactly what the governors have asked. The State Flexibility Act fully repeals these burdensome Medicaid MOE regulations. It starts to put states back in control to balance their budgets while simultaneously lowering federal entitlement spending. Now, our legislation will save taxpayers $2.8 billion over just the first 5 years. That's a lot of money. And regardless of political affiliation, I am confident that this bill has the potential to garner strong bipartisan support in Congress and represents a strong first step toward achieving comprehensive Medicaid reform. Any senator who has talked to his or her state's governor knows that we need to pass this legislation to enable states to survive the current fiscal crisis and to better care for the most vulnerable Medicaid beneficiaries in their respective states. Now it's time for Congress to roll back these unreasonable MOE mandates and put the states, not Washington, back in charge. Now, I'd just personally like to thank you, my colleague from Wyoming, Senator Barrasso, again for working with us on this legislation. Without you here, I don't think we would be able to do anywhere near as much as we're doing. You, in particular, bring a unique perspective to the debate over MOE requirements, and I don't know of any senator who is serving a state any better than you do. And all I can say is I would appreciate hearing more of your thoughts on this matter, because you're the one with the experience, you're the one who's helped people, you're the surgeon who has operated on countless people. You've done it whether they've been Medicaid beneficiaries, people who have insurance, or people who have nothing. And I know you've done that, and I have great admiration for you. But we also know that these states are being heavily burdened with these MOE requirements that are just bureaucratic unnecessaries. And I'd like to hear from you just how important this is.
I appreciate the kind comments of my colleague and neighbor from Utah, because I have seen Medicaid patients, taking care of Medicaid patients over the years, and I know that this is a program that is burdensome, and I've served in the state legislature, so I know that the mandates coming out of Washington make it harder for the people back home to take care of patients, to make it harder for our state legislature to deal with helping people on Medicaid, making it more difficult for physicians to take care of those patients, making it more expensive, and there's a lot of waste in the mandates. So when Senator Hatch talked about some comments from your governor, I have comments from our governor as well. Governor Matt Mead, a new governor, has been in office just since January, and he wrote and was one of the 33 governors that signed a letter to President Obama talking about the costs of maintaining their Medicaid program are fast becoming a serious threat to the state general funds, and we live in a state where we have to balance the budget every year. He went on to say Wyoming needs to have flexibility, which is the key word and the title of this the bill that has been introduced by Senator Hatch, Senate Bill 868, State Flexibility Act. That's what governors are asking for. Flexibility, because with that flexibility, they can do it better for the patients and they can do it cheaper. So as he says, Wyoming needs the flexibility at the state level to ensure the Medicaid program is operated efficiently and effectively. And you know, people, when they look at Washington, don't believe they're getting efficiency and effectiveness out of Washington these days. They don't think they're getting value for their money. And I agree with the American people. I've heard them loud and clear. I said it when I was practicing medicine, and I say it today as a member of the United States Senate. As our governor goes on, he says Wyoming strongly supports the removal of these maintenance of effort requirements. But this is why I come to the Senate floor every week, Senator Hatch, to talk about this health care law, the implications in it, the impact on the people of this great country, and why I think that this health care law that is one that is ultimately bad for patients, bad for providers, the nurses and the doctors who take care of those patients, and also bad for the American taxpayers. And at a time when we're borrowing 41 cents for every dollar that we spend in this country, we cannot afford to continue to waste money. And our problem in this country is not that we're taxed too little, it's that we spend too much and don't spend it well. We have to begin focusing differently, and one of the ways we can do it, because my understanding from looking at this is that actually the Congressional Budget Office, who does the scoring on pieces of legislation, scored your State Flexibility Act as actually saving, I think, $2.8 billion total over 5 years. And isn't that what we're trying to do? Save money, help people, do it more efficiently, more effectively, and that's why I'm proud to co-sponsor with my friend Senator Hatch the State Flexibility Act.
And give the states flexibility to be able to do what they can do better than the federal government. As a former medical liability defense lawyer, back in my early days, I represented doctors and healthcare providers, nurses, and hospitals in defending them from what really were, in most cases, frivolous suits that run up the costs of medicine. And I can't tell you what it means to me to have you here in the United States Senate with all of the medical experience that you had. And frankly, the states can do the job, but they can't do it within budget if we keep piling regulation and onerous burdens on them like the partisan health care bill does. And frankly, I just want you to know that I just feel an honor to serve with you and an honor to have a couple of medical doctors on our side. You and Dr. Coburn are both excellent doctors. You've lived through these problems. You know what they're like. You don't have to have anybody tell you what's wrong with the approaches we're taking here. You know what's wrong. And frankly, I just want to thank you for being willing to serve here.
I appreciate the kindness, and I appreciate the fact you're allowing me to work with you. You have a long and illustrious career of leadership in the United States Senate, and you have been a champion of the fact over the years that states are better than Washington to make decisions, because what works in one state may not work in another state. And if you give states the flexibility, ultimately they will do it better. They are the laboratories of democracy, and that's why we believe in limited government and making decisions at the local level as close to home as possible, which is why I know so many governors across the country support the State Flexibility Act, and I'm hoping we get a successful vote here in the Senate on that, because whenever Washington makes a one-size-fits-all decision, hardly ever works for most folks back home.
Oh, that's right, and I believe this will have great bipartisan support among the governors and hopefully in this body as well. Thank you for bringing this to our attention on the floor.
Well, I want to thank you, Senator Hatch, and with that, Madam President, I will tell you, I still believe that this is a law that it is bad for patients, it's bad for the health care providers of this country, the nurses and doctors who take care of them, bad for taxpayers. I'll be back at home in Wyoming over the weekend visiting with patients as well as providers as well as taxpayers, listening to what they have to say. And I know the people of Wyoming have great concerns about this health care law and would like the kind of flexibility that is described in Senate 868, the State Flexibility Act. With that, Madam President, I yield the floor and suggest the absence of a quorum.